I know what you're getting at, and there's some truth to it for sure. What my concern is what's called iatrogenic harm, and what that means is that the healer is aware that they can cause harm
Oh,
to the client or the patient. And that's something that you're trained against. You remove yourself as an entity from their life as much as humanly possible, meaning we always want to check our egos. So it's not when you come and see me and we talk through a level of trauma, or something that's really precious and really, really, really affecting your psyche. It is absolutely critical that I keep my analysis and my personal judgments of that moment separate from you while you parse through those things, because it's too complex of a moment for me to insert myself. And for me to go in and be like, oh, I can see judgment A, judgment B, judgment C as I'm going through listening to your story. What I'm actually doing is called memory contamination, because the way that memories are stored and recall of these moments, these really big moments, you're not recalling the event itself, you're recalling the last time you talked about it. And now I have just put into your headspace something you can never get away from, which is my suggestion of judgment of whatever was there. Now, it might be that I'm right. If we had a movie camera and I did make a judgment and we look at this from an objective perspective, that I'm dead right, that this judgment is absolutely true. However, that moment, the movie camera element to this, when you're dealing with trauma, is irrelevant, because the trauma is how the thing was stored in their headspace, not what actually occurred. So when you're doing trauma
yeah.
work, you're helping the person understand what was stored, not looking for what was objectively true, which may not even be available to them.
Okay. Can we pivot for just a second? Because that is a very helpful clarification for me. So I just want to pivot for just a second because I don't want anybody to hear maybe me say something that was clunky and then them, be hurt by it. So maybe how I should perhaps word that in a different way would be what you're describing as the trauma, the traumatic event, the thing that's stored it's irrelevant. Like when I say, you have to know it's true to know if it's harmful. The harm can actually be there even if the objective standard outside is this or that. That kind of is irrelevant when it comes to what's actually stored in the mind as trauma. So maybe in the application to deconstruction, maybe you can comment on this, is like, let's say somebody feels harmed because their church said, you have to repent and believe in the gospel. And they say, well, I think that's harmful to me because I'm taking this particular sin on as an identity category. And now you're telling me that I need to repent of who I am. And so that stores it as some kind of a trauma. How would you as a clinician help them work through that while still pointing them to a biblical worldview?
Yeah. Oh, that's wonderful. No, that's a great clarification, because you and I are both apologists. So we have
Right.
to like make this distinction all the time. Yeah, good. So all you have to do is what makes us a trauma informed apologist is to just separate. So we say, okay, we can see now, you and I, as we're going through assessing this, we know that this is the objective standard and what was occurring. We know that what you're describing now is far from the objective standard of what was being taught. And what do you suspect was stored from that moment is what I would be asking them to process. Because not only are we going to go back and try to deal with the scar of cognition, which is what trauma is, just in and of itself, whatever it was, it's not relevant whether or not it's objectively true. We're going to treat it as it was. But we're also going to form a new neural pathway that we can then reinforce as an alternative for their brain to hang on to. That is the accurate way of understanding how this theology was being used back then in a way that was false or misleading. So we have a new neural pathway, a novel headspace that they can hold on to now that they've arrived in the present, while we're treating the trauma in the past.
Okay. Like I don't want to go off on a whole other topic. Maybe we'll have you back to talk about trauma in general because and maybe I'll just ask you one more question. I really don't want to get off the deliverance stuff because this is so
No, it's
fascinating.
okay. It's all
But
right. It's all right.
you're a really fascinating person. So I feel like I just have so many questions for you. But okay, one more just in this space as we're talking about trauma. Do you see any sort of application of trauma-informed care or the trauma-informed world as being co-opted in any way, shape, or form by the critical theories of like the oppressed versus oppressor type of approach to that?
It absolutely can be. I've seen that many times. There is well, you and I were at the conference, right? We were just at
Yeah,
this
be
awesome.
emboldened, yeah.
Yes, yeah, and when those lectures become available, my talk was discussing the 5 camps within psychology and Christianity.
Oh,
And
okay.
there's an association for Christians in health and human services that deal with this issue primarily. And it's that, yes, their psychology can be all across the board, and trauma care can be all across the board for what you're going to get. It really matters who you let into your brain. So
Mm,
be really research who you want to treat you. That being said, there are people within the psychological community, and there are many of us now, that are completely anti that type of those. We are always looking at oppressors versus the people who are oppressed, and having these firm like ways of understanding trauma that are like categorical. Because from what we can tell, as far as how, at least the neurology, most things are a spectrum, and trauma itself and the rapidity with which your cognitions are scarred is based upon your own idea of how your worldview is to be walked out.
mm,
So it's less important that we go to these categories of analysis that you would see in critical theory, and more important that we understand and let the person in our midst who is looking for help understand what were the undercurrents and presuppositions that helped them arrive at a moment where whatever happened to them scarred a cognition so severely.
got it. Okay. All right, fascinating.